Okay, well, we were adjusting the camera, so this is a live show. I'm Dr. Reiner, and your host of the Independent Doctors of Pahrump. And so for your call-in convenience, the number will be listed below, 727-8750. And certainly as our call volume has seemed to have gone up, when you do call in, please ask your question and then so politely hang up so that you can listen to the answer. And if you need to call back, please feel free to do so that we can discuss whatever additional information you may need as a result of the topic or discussion that I had. Again, since we've had a numerous number of call-ins, I have not really prepared anything in particularly as far as a PowerPoint presentation for the show. I do know that it's cold out there, and so you have to excuse me. I do have this additional jacket on, and as the wind is blown in from the north, our weather, our temperatures have gone down pretty substantially, and we do ask that, you do protect yourself in the cold weather, and wind chill is a very, very important factor in temperature. In fact, I probably should have had a listing on that to show you what the difference is, but it's real substantial. Ray, you're on the phone.
Yes, I am. Good to see you again, Doc.
Good.
I love it when you show up and you show up on time. That's fantastic.
I'm trying.
Hey, I was watching the news just before you, and there were a couple things that really piqued my attention. And that one was a woman was operated for knee surgery, and she wound up with E. coli infection, and it was very serious. She had to go to Rose Hospital for some kind of wound treatment. I didn't think that normal operations would, like on the knee, would have something on your backside affected. It must have been something with a bed sore or something that exacerbated the situation. But it was really upsetting, and I know you didn't get a chance to watch the local news because you just arrived there, but it was on Channel 46, and you ought to look at that segment. The second thing is they had another one about residency, how the residents are like put under so much pressure, now they're getting very depressed, and this is like an epidemic. And I know you went through the residency, and they said it's the same right now like it was back in the 50s and the 60s. There's tremendous pressure. So if you can talk about those two things, and I'll listen after I hang up. And thank you so much for being here today.
Ray, before you hang up, we adjusted the volume. Your first question had to do with a patient who had an E. coli infection. Is that correct?
That's right. She had knee surgery.
Knee surgery?
Right. I think her name was Strong. It was just on the show before you went on. She had knee surgery, and her backside, she got an infection, and it was so serious. It was an open wound, a large open wound. She had to be transported to Rose Hospital, where they treated her for some kind of open wounds. So they got a procedure to close it up. And I couldn't understand how from knee surgery you could get to a backside infection from what they said was E. coli, and very, very serious.
Okay.
So if you could explain that, I appreciate it, and I'll let other people call it, because you've been getting a lot of calls lately, Doc.
Yeah, no, it's been good. You certainly have been paving that way, and thank you for being the brave soul to ask very excellent questions. I appreciate that. So, yeah, hang up and then...
Yeah, you have a good show. I'll talk to you later.
Yeah,
bye-bye.
Okay, yeah. All right, so the news lady came in and said that she actually had a bed sore, and that's basically what I was going to attribute that to, but most likely, and I don't know, I didn't really see the segment, so I'm only commenting on what I see a lot of in general medicine, is that bed sores develop because people don't move. Your skin, when pressure develops, it cuts off the blood flow to the skin, to the epidermis and dermis, and therefore the skin breaks down. It doesn't get the nutrients that it needs, and more very common over bony prominences because they have less fat and they have less muscle. So when you have those bony prominences, such as the sacral iliac, which is a very common area for a bed sore, heel is a very common area for a bed sore, any ankle where you're turned on the side, or a knee, or or things of that nature as a very common place for a bed sore. And it doesn't take long for them to develop. If you've ever laid in a bed for a extended period of time, it can become just as painful as if you were up moving with arthritis. So people don't realize that people that lay in bed can be just as painful as people who are really have other common conditions. It's that constant movement that keeps us loose and agile and keeps our blood flowing and keeps the nutrients coming to the skin and the skin tissue. So when there is wound breakdown, I would imagine anybody who laid around long enough to get a wound breakdown might also suffering from, unfortunately, a lack of good hygiene with a bowel movement. So it's very common in the sacral iliac or bed area to get an E. coli infection from stool and other contents that aren't really clean very well, getting up into their moisture, especially if they're in a diaper or something along that line, and nobody's really attending to cleaning a diaper on a person, an elderly person. On a baby, their skin is pretty young, fresh. They got a lot of fat on their body, and they're being, I mean, you're attentive, you're changing them all the time. And adults, sometimes, unfortunately, with the current care system that we have, they may lay around for an extended period of time, and so that may develop a sore in that area. So that would be what I would probably say was the most common cause for that particular issue. And they can be quite nasty, of course, as you have a knee, they don't move very well, it's sore. And that's one of the things about joint and joint replacement. You really have to be in very good shape to extend or to replace a joint. The hips are easy to replace, and they actually do very well compared to the knees because of the amount of tissue. The hips move very well, they move in a limited motion, but the knees, because there really isn't a lot of muscle around them, there's a lot of skin, so it doesn't take a lot of swelling to cut off circulation and create an edematous situation below the knee. And even though they put the incision on the anterior part of the knee, there's just a lot of issues that take place with that. It bears 3/4 of your weight or more. You have to have good muscular conditioning to basically undergo the surgery. And the problem with that is you usually meld to that bad knee or the bad hip, and then all of a sudden now you've got a brand new hip, a brand new knee. It's bionic in that nature, and your body is really out of tune with the new alignment that you've just been given overnight. And that sometimes creates its own problems. And I've had a couple of patients that have come into the office that have developed new pain as a result of fixing their old pain with regards to their knee and their hip replacement. And usually it requires an alignment. And I had one good patient that did that and went back to the orthopedic doctor, and the orthopedic doctor said, well, you know, the x-ray looks good, the prosthesis is fine, I don't know why you're hurting. Well, it was obvious that it corrected, she had a really imbalance in her gait and her step of almost a couple of inches, and then when she came back like this, now she was normal, all of a sudden that put a strain on areas that hadn't strained. So we recorrected where she was and then gradually reduced it, and the pain went away, and she was actually in pretty good shape with the replacement. So for those people that are impending to have knee or joint, knee or hip replacements, it's important to understand where you are and where you're going to be and where things are going to be happening, and how quickly it's going to take for you to regain your strength and your conditioning. The other thing is get in a good exercise program before you get your knee or joint replaced, and you have to consider the consequences that might be worse after the surgery as opposed to before the surgery. There's no guarantee that, like I say, you get a bed sore, you get a pneumonia, you get another infection. And sometimes in this case, and I've said this often many times before, the cure is worse than the disease, meaning the outcome is worse than what you have. So you have to be very, very careful when you're anticipating those surgeries. Now, I did have a patient come in recently who had an anterior approach to his hip. And apparently there's a group of physicians doing those in Vegas. He was up walking that day. certainly a much less invasive procedure, and there are limited knees where they do partial knees where they don't replace the whole joint, they just put in a partial prosthesis, and that's would be my preference to get the minimal, what they call minimally invasive repairs done. Those are extremely valuable as far as rehabilitation time and trying to get you back to normal as soon as possible. So I know you asked about the bed sores, but it digresses into the joint replacements where this is how this lady developed that, and that's one of the unfortunate side effects of that. And nursing homes and people that are debilitated get bed sores very, very commonly, and it is something to watch out for. They need to be moved, they need to be constantly pressed, and sometimes they use what they call a low air loss mattress, which is actually an air bed, and that helps reduce the pressure on that particular bony prominence. It doesn't prevent bed sores, but it does help to reduce them to a basic minimum so that you can help to prevent that outcome. So we're going to take a small break, and we'll come back and deal with the second half of Ray's question. Thank you for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.